As we all know, that Alaska is very rural. They have a lot of villages, and the villages sometimes would have to take by boat or airplane into Anchorage to receive their health care. The CHAP program is the Community Health Aid Program. It was first established in 1968 in Alaska. So how CHAP has worked in that instance is that they were able to train somebody within the local villages to provide health care service to the actual villagers at the local level in their community.
The program that we see today really grew up organically from that program in Alaska that started out as a way to solve a single problem, I would say, and now has grown into really the backbone of primary care in Alaska Native villages. And so what we're hoping to do here in Washington, Oregon, and Idaho with our tribes is really take those pieces of the Community Health Aid Program that will serve our tribes in our quest to sort of improve access to primary care, improve access to primary dentistry, improve access to that behavioral health care that's so hard to get in our communities, and to look at continuity of care issues.
To address the barriers, the Community Health Aid Program trains and employs community health aides and practitioners to be the front line of medical care, providing acute care, well child, prenatal care, emergent or urgent care, and chronic care.
It's cost effective. It keeps the community members from having to travel from the village to a hub community where there is a hospital and providers. If you look at the current airfares from the village to a hub community, it could go somewhere around in my region, $350 one way.
I think it's important to have this program because it provides community members with care they would otherwise have a hard time accessing due to location and lack of providers.
The critical need of supporting CHAP by our tribal leaders and by our community members is critical to address health inequities in those communities that are faced with opioid crisis, meth, fentanyl, addictions, and how do we respond to that? And I think CHAP is a venue that speaks to the crisis that we're in, and I call it a public health crisis because that's what it is, and we're losing lives as a result. So CHAP is critical for tribal nations.
There's 38 federally recognized tribes in Oklahoma. A lot of the communities are in a rural setting. They may have one city hospital, they may have one IHS-operated facility, or even a tribally ran operated facility within their community, but some do not. So I think that CHAP being implemented within the Wichita and affiliated jurisdiction, as rural as they are, that it would help bridge the gap between the Indian Health Service and the ability to go out to the community with all of the social determinants of health that relate to the health disparities as far as transportation, gas money to go to the store, child care. This makes it accessible to those that have those issues and can't make it to the doctor.
I love seeing the success stories. I love seeing the difference that I make in people's lives. I love seeing situations that if I weren't there, then something bad could have happened. Just knowing that I made a difference, it's priceless.
Providers that are connected to the community have a different investment in their community. The benefits are, it's a community that you know, that you're familiar with, that you want to live in. What we see a lot of times in tribal communities, because they are a little bit out of the way, is people will come and it will be hard to sit down roots, or maybe their roots are elsewhere and so they don't stay as long. And so individuals are always having to retell their story or restart their care, and so there's no real continuity of care.
Culture does play a big part in being able to give care to patients. I feel like patients are more receptive to care if they see providers that may know where they're from, or they have the same family members, or they live in their community. It makes them a lot more comfortable so that they're able to really hear what they're saying as opposed to a stranger who may be coming in and just seeing their chart for the first time.
If we had these this CHAP program, that we could have our own people, and hopefully they would be more open to telling them, this is what's wrong with me, this is what's going on, and that person can advocate for them. You have to consider the person and the personal things that they're going through, because your training may not always address those things.
As two Indigenous people coming together, we understand kind of the landscape of the work that we're in. We bring cultural nuances into that space without, still holding our boundaries in some respect. But that kind of dismantles, that provider-patient relationship that we go in, our client. It sort of just kind of pulls that away, and I think you'll see better health outcomes when you do that.